Good morning, everyone. I'm Dr. Peter Russotto, your host and moderator. This edition of Medical Minutes is being brought to you by Passavant Hospital. Today, we will be talking about occupational therapy and all that it has to offer here at Passavant Hospital. In the booth with me is Todd Thorsen, an occupational therapist. Basically, I'm going to start the questioning off, Todd. What is an occupational therapist and what do they do?
Well, good morning, Dr. Russotto, and thanks for having me on the program. Occupational therapy is a profession that works within the medical model. It's a medical profession that promotes health and wellness through assisting people with activities of daily living. It may be that somebody has muscle weakness or has had a surgical procedure that they can no longer maybe dress themselves, so we will provide them with adaptive equipment or things like that will increase and enhance their ability to do their self-care skills or activities of daily living.
So basically, it's to enhance their ability to do everyday simple tasks?
Correct.
And sometimes this might even be a patient who suffered a cerebral vascular accident or a stroke that has some paralysis?
That's right. It may be that we teach them a different way to do things. We call that compensatory techniques, to dress one-handed or to be able to lean forward with enough trunk control to put on their socks or shoes or wash their feet, that kind of thing.
Even some simple tasks as to washing clothes, laundry, that type of stuff?
Exactly. We kind of work our way up the ladder from self-care skills, your grooming, your hygiene, that sort of thing, to the other things you have to do to take care of yourself, like laundry, like cooking, like even going to work.
So to keep a person basically, or to gain their independence.
Correct.
So where do occupational therapists work? Is it only in a office setting or is it in a hospital? Can you answer that question for us?
Sure. They work in a lot of different places. Hospitals are probably the main place that you might think you would have an OT work, but they also work in inpatient rehabilitation facilities, outpatient clinics or offices. They actually go into the homes of some people, home health therapy, to have people practice some of the things they need in their own house so that it could be specific to their own layout of their home. OTs work in schools. They work in industrial rehabilitation clinics because, part of occupational therapy is getting to work and going back to work after an injury and being able to work at the same level that you were prior to your injury. Inpatient and outpatient psychiatric settings even.
You mentioned rehabilitation centers. I take that would also be like skilled nursing facilities also?
That's correct. They work in nursing homes and even assisted living and independent living.
You touched a little bit about occupation. I guess there would be things like work hardening skills you assist on, those kind of skills? Yes.
Work hardening is a bridge between the acute care setting or the outpatient setting where you're working on specific muscle strengthening or just general endurance to work-specific type of activities. Like if somebody works in a warehouse, you might have a person practice lifting boxes for the length of time that it takes for you to complete a workday, 6 to 8 hours. People come to the industrial rehabilitation clinics and work on that sort of work task specific.
Well, that's very interesting. So really, how does an occupational therapist differ from a physical therapist?
Physical therapy likes to think about things in like muscle strength, weakness, tightness, imbalance of your muscle abilities, and how that might cause you to walk a way that is not functional, that your walking is not balanced enough. They might think it's because this certain muscle is weak or it's tight, and they'll work exactly on the specific muscle that would be responsible for having your gait be imbalanced. They work with big muscles like your back muscles and your legs muscles, and they really put a lot of emphasis on ambulation. And OTs are a little more task-specific. We are a little more of a generalist.
I see you sometimes working with patients on real small little objects, so I guess you would concentrate a lot more on sometimes fine motor skills, correct?
That's absolutely correct. We might be doing little pegs, where you see us back there doing little pegs. That translates into buttoning buttons and fasteners and things like that.
Or, even putting a nut on a screw and everything, which sometimes is very important for somebody to keep their job.
That's exactly it.
What is the education commitment, or how does it differ from an occupational therapist, occupational therapy assistant to a physical therapist?
Physical therapist and occupational therapist are somewhat comparable in the requirements it takes to get into a physical therapy or occupational therapy program. You have to go to a college, you have to complete a degree of some sort, and then you have to apply to occupational therapy or physical therapy school. Some schools have what they call direct entry, and if you come in and you're an OT student, and that's great, and as long as you keep the grade point average, you continue through their program. At the end of it, you're an occupational therapist. Other places have you complete some college, and if you take the prerequisites required, then you can apply, and if you get accepted at the end of that series of classes, then you're an occupational therapist. A certified occupational therapy assistant is an associate's degree. Most community colleges have those programs. Lincoln Land does, Lewis and Clark does. They require that you take courses in order to get in that program too, but you don't have to have a degree to be a certified occupational therapy assistant.
Now, you said most of the people go from like a 4-year degree, whether it's a BS or a BA, into occupational therapy school. Is that a 3-year program or 4-year, or does it differ from certain states and different schools?
It varies from school to school. 36 months is usually the usual number for what it takes once you apply and get accepted to an OT school.
Now, you don't work independently. Do you work with a prescription from a physician before you can see the patient, or can a patient just seek your services out independently?
You need a physician's prescription in order to receive occupational therapy services.
Does most insurances like Medicare, Blue Cross Blue Shield cover your services?
Yes, Medicare covers occupational therapy, and so do most private insurances. Every individual's policy is different, so they may cover it to some different extents, but it's a profession that's recognized by the insurance industry, and they'll give coverage for it.
So basically, like you stated, you would first go to your physician. Your physician would say you need OT and sometimes PT in conjunction, occupational therapy and physical therapy, a script, and then they go to your office. How could they contact you or your department?
Well, they can call the hospital at 217-245-9541, and our extension is 3397. You can ask for me, Todd Thorsen, or you can ask for an occupational therapist or a physical therapist for that matter too. And then if you don't have a prescription, you can ask maybe how you might obtain one.
How long do your sessions usually last, or is it tailored to the patient's needs?
The first session on an outpatient basis usually lasts an hour or a little longer. Then after that, it's tailored to the patient's need. It may be as short as a half hour or as long as an hour.
And is that usually every day, every other day, weekly, or again, tailored to what your goal is for that patient?
As an outpatient, it's either 2 to 3 times a week. Inpatients, people that we see in the hospitals, every day.
And most of the time, this is usually Monday through Friday, not weekends.
Correct.
Except maybe in a hospital setting, you might have to do something on a weekend, correct?
Right.
Well, that's great information, Todd. We thank you for all you do for Passavant. Is there anything else that you'd like to touch on for the listening audience?
No, I think I pretty much covered it.
Well, thanks again for coming, and thank you to the listeners, and good health.